All right, good evening and welcome to the May meeting of the Young Adults Advisory Council. Per usual, we're going to do the very long script before we dive into today's agenda and subcommittee meeting. All right, so to conduct this meeting wholly electronically and to effectuate both the emergency procedures authorized by FOIA and the emergency ordinance, the Young Adults Advisory Council, further known as the Council, needs to make certain findings and determinations for the record. It's been cumbersome, so I ask for your patience in advance. First, because each member of the Council is participating in this meeting from a separate location, we must verify that a quorum of members is participating and that each member's voice is clear, audible, and an appropriate volume for all other members. Accordingly, I'm going to conduct a roll call and ask each council member participating in this meeting to state your name, your location, and location from which you're participating. I ask that each of you pay close attention to ensure that you can hear your colleagues. Following the roll call, we will vote to establish that we can hear every other member hear each other, basically. All right, Denver Stupinger calling in from Fairfax, Sam Niner.
Calling in from Springfield.
Wonderful. Vera Bufano is not on. Casey Judge.
Hi, Casey Judge calling in from Annandale, Virginia.
Awesome. Judith Kupla is not on yet.
I'm here, Denver.
Oh, hi.
Hey, sorry, I joined a little bit late. Was kind of scrambling here, but Sujit Coppola calling in from Vienna, Virginia.
Wonderful. Dini Muhammad. No, Dini Eddie Silva. Sandoval. Sorry, I butchered that.
Yes, Eddie Sandoval speaking, council representing Surrey District, calling from Chantilly, Virginia.
Thank you. Richmond Hill.
Richmond Hill, representing Northern Virginia Community College, calling in from Woodbridge, Virginia, actually, this evening.
Wonderful. And then Manor Zafar.
Present, calling in from Springfield, Virginia.
Thank you. At this point, I will pass the virtual gavel to my fellow council member, Casey Judge, so I'd be heard to make a requisite motion. I move that each member's voice may be adequately heard by each other member of the council.
Is there a second?
Second.
All right. All those in favor say aye.
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 Hi.
Opposed? All right. Motion carries.
Wonderful. Right. Second, having established that each member's voice may be heard by every other member, we must establish the nature of the emergency that compels these emergency procedures, the fact that we're meeting electronically, what type of electronic communication is being used, and how they have been arranged for public access to this meeting. Therefore, I move that the state of emergency caused by COVID-19 pandemic makes it unsafe for the council to physically assemble and unsafe for the public to physically attend any such meeting, and that as such, the FOIA's usual procedures, which require physical assembly of the council and physical presence of the public, cannot be implemented safely or practically. I further move that the council may conduct this meeting electronically through a dedicated video and audio conferencing line, and that the public may access this meeting by registering through the meeting link on the Young Adults Advisory website, which is www.fairfaxcounty.gov/economic-initiatives/young-adult-advisory-council or by calling 1-571-429-5982 and entering access code 350-251-941#. It is so moved.
Is there a second?
Second. I second.
Great. All those in favor say aye.
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 Opposed? All right. Motion carries.
I have a
Wonderful.
question. Real fast. I'm sorry to interrupt.
Go through the script.
I was just trying to get the transcript. That's all.
Jared, if you're saying something, you're muted.
Denver, just go ahead and proceed. Sam, we have to finish the FOIA script by law.
Yeah. Finally, it's required that all matters addressed in today's agenda must address the emergency itself, are necessary to continue the operations of Fairfax County government, and or statutorily required and necessary to continue the operations and the discharge of the council's lawful purposes, duties, and responsibilities. It is so moved. All right, are there any dissensions or edits to today's agenda? Hearing none, the agenda will be carried. Jared, I don't believe we have any members of the public in attendance, nor did we have any public testimony written in advance, correct?
That is correct. We may, well, technically Paul is a member of the public, Mr. Steiner. And we may actually have another one calling in, possibly for the full council meeting. But no written testimony.
Yes. Hi, everybody. I'm here tonight, but I'm currently fighting a blackout in Lake Ridge, Virginia, so I'm on my cell phone for as long as it's going to last. But I'm here. Apologize, I'm not on camera, but I'll be on camera for the next one. Thanks, everybody.
Thanks, Paul.
All right. So, stiff welcome. We decided, since we don't have all the members of the pit on, that we're going to do a joint conversation of what outreach and engagement looks like, our year plan, and all that great stuff. So I will give the floor to you. Oh yeah, and you asked about transcriptions. I don't know if transcriptions are enabled on Teams.
They aren't. I don't think.
Sam, what is the question?
Transcript? I wasn't too sure if there was access to the transcript for the for everyone talking.
Yeah, I basically get the transcript, yes, from running the meeting and for posting it, yes.
Sam, and I have a question. Oh, sorry, go ahead.
I was going to say, if you click on Teams, there's 3 dots for more, and there's an option that says show transcript, and it'll give you the live transcript as we speak, if that's something you want to. Yeah.
Thank you.
Awesome. All right, Judith, the world is yours, but also is the floor. So I will hand the gavel over to you, sir.
Hey, was that me? So
Yes, decided that we're gonna just jointly as a committee talk about outreach, our year's plan, what outreach will look like, our agenda, and all that great stuff. Because we did that with the pit last go around. So I will let you lead that if you feel comfortable in doing so.
Yeah, I might just need like a minute or two just to kind of pull up that document. I was just a little late in signing on, so I'm just working on pulling that up. So if there's something we can do, just maybe for a few more minutes, I can work to get the doc pulled up.
Absolutely. What fun can we do? So I guess we can just go around and say, gaps and or opportunities, specifically when it pertains to Fairfax County government, when it comes to outreach to communities, and we can be specific on, a specific community or on, communities in general. So gaps and opportunities and your perspective there. Casey, you're the first on my screen, so would you like to start?
Sure. This may be stating the obvious, but in terms of gaps, if you go to really any public meeting that has to do with a county policy or something that the board's discussing, there's a lack of young faces in the audience. There's a lack of people with certain backgrounds, and you can tell it's the same really 10 to 12 people that come out the squeaky wheels to oppose policies that I think a lot of people in our young adult community might really benefit from. So I think that's a huge gap. And also I think there's an opportunity for the county to really reach our group in a better way. I think the pandemic has brought about the virtual meeting options, which gives us more flexibility in participating, of course. But I still haven't seen a concerted effort to really target and bring these topics to us in a meaningful way. So I would really like to, see that at a countywide level to make sure that our voices are being heard.
Absolutely. Sam?
Yes, I agree with Casey, Judge, and we should add a bigger audience full of younger adults, as we haven't been getting that big of an audience. and to the desirable outcome, I would hope that we would be able to reach that with getting younger adults in the audience.
So who is we in your analysis?
As in education, like high school students and college students.
And then we as in just overall government operations?
Yes.
Awesome. Thank you. All right. Richmond, hello.
Hi. When you asked the question, I thought about our student government, group at Northern Virginia Community College and our student life leaders. A lot of them come to me often, I must say, via email and phone about things that they're, passionate about, not only at Nova, but in the community. And for our, Annandale campus and students who attend the Alexandria campus but live in Fairfax County, I think they have something to offer and maybe a voice that is untapped and probably don't know that there's an outlet, for them to share or to, as you were saying, participate and be a part of some of the meetings and just sharing what some of the concerns are. And, by and large, most of them that are, participating in student life and student government are in that 18 to 24 range. So I would be happy to, help connect the dots a little bit at Nova, for our campuses that are seated in Fairfax County, for there to be some student voice there.
Thank you. Eddie.
Yes.
Yeah, do you have a response to the prompt, or do you want us to skip over it?
Yes, I can respond about the possibility for one younger adult should participate.
Oh, that was your kitten.
Very
I'm-
cute.
She's just yelling at me right now, so I have to hold. Yeah. Eddie cut off on me. Did he cut off on you all? We'll go over to Manor.
Hey, sorry, I was dropped out of the call earlier and I missed the prompt. If you don't mind repeating it.
Yeah, what are gaps or opportunities when it comes to Fairfax County and increasing its outreach and engagement to any population, you say general population or any population specifically, if you have a specific.
Sure. No, okay. The answers make a lot of sense now, right? I agree with Casey. I do think there is not enough presence. I think one of the reasons for that is it's not economically feasible for most people to come to these meetings. So maybe encouraging other boards or other methods to get the community engaged, as well as making sure those exist, but also like having people utilize that resource.
Yeah, thank you. Paul, I know you're in a blackout, so I don't know if you have anything. And I'm going to kindly switch devices. I'm going to pop off and pop right back
Paul, are you still kind of on, Paul?
Yeah, I'm here.
So, Casey, do you want to, or I guess I could. So Denver had to switch devices, but basically she was wanted to kind of get everybody's take in what kind of gaps that this demographic for young adults being 18 to 34 have with, kind of engagement and everything with the Fairfax County government. And Casey used a great example of just kind of same individuals showing up at in-person public meetings during the day. Maynor, definitely made a great valid point that it's not economically feasible to leave work and do that during the day and all that. So just curious about just anything in terms of like outreach and everything, which I know you do a lot of, certainly with your work with FCPS.
So, one thing that in that age group, one thing that's prevailing is the push towards attending a four-year university. And it seems like that really dominates a lot of conversation, right? Or it's the prevailing narrative, okay? But there's many, many students that do not pursue the four-year university path. They start a career. They go to Northern Virginia Community College. They take classes with my program. Pursue the military, and some of them even take a gap year. So there's a lot of different things that those young people are doing, and how do we integrate that into what we do? How do we make programs more accessible for that age group? I think it's just you hear from a lot of people. Let's say if you just caught someone walking on the street, they would say, "Oh, everyone's going to go to a four-year university. That means they're going to travel away from home and live in a dormitory outside of Fairfax." That's kind of like the prevailing narrative, but that really does not apply widely across the board. And understanding that and doing what reach those individuals, I think, is
Okay, great. Yeah, thank you, Paul. You cut out a little bit, but I think that those are some great points. Eddie, do you have a question? I saw your hand raised.
Oh yeah, sorry about that. Because I have a long picture going on. Sorry, but so what I'm trying to say is that maybe we should participate. Young adults should participate or volunteer to join participate what's going on in the community, advocating on what for advocating and good people for young adults and people with disabilities. So disability like that, and for people who are good resource for me my age, I feel like 8 to 29 or 8 to 34 or 18 to 26 to get involved here or to participate to see what's going on in the community for young adults to develop the experience.
All right, and then with that said, Judith, I'll let you lead because it looks like you're ready to go, and we can figure out what the next steps are with outreach, our direct ask to the Board of Supervisors, staff needs, all that great stuff. So I'll hand it over to you.
Great, thanks, Denver. Thanks for kind of indulging me there. I've been stuck at the office today, so I've been kind of switching back and forth. So in terms of several of the items that I know my subcommittee, one of the, that we discussed at least last term that we wanted to continue to, I think, build upon in this term. I just want to make sure I answer your question, right? So is the thing that you're really looking for me to share right now, is it direct kind of outreach tactics that we kind of settled upon, or is it mostly just focus areas that our team is planning to kind of focus on over these next few months in terms of deliverables or outputs?
Yeah, I think our hope is to make solidify plans on what those deliverables are and direct asks are of the county. So we have a Department of Civic Engagement and Education, and what does that look like? Which we should, and other localities do, right? Where we constantly go into the community and tell them what the budget is and how it works. But yeah, I'll now shut up and give it over to you.
No. That's helpful. So I think one of the things that we had initially, I think, proposed was in general like a smaller scale like testimony, either to the board or at least to the department itself. But I think one of the things that we talked about was that might not probably be the most effective way to provide a recommendation. And rather, one of the things that I know our subcommittee wanted to work on that would just be easier to kind of channel our efforts would just be a white paper, right? The main deliverable that we kind of built in the last term was that we essentially just kind of marked up the Fairfax County strategic plan and just incorporated various bullets and different ideas within the lens of talent, education, and outreach. And so we wanted to either just kind of turn this into a white paper and submit it to the relevant department, or just have like a sit down meeting with some staff members from that department and just talk them through our recommendations, right? That seemed like the most straightforward way to speak with, the authorities on the matter, people who would probably be best suited to, listen to some of our recommendations and act on them. So I know we have our draft strategic plan that we've marked up, that we've revised, that we've put together. Right now the decision is basically, do we want to submit this in its current form? Or do we want to turn this into a longer term white paper, right? And that was something that I was going to ask the rest of my subcommittee. So that kind of answers your question in terms of what is the deliverable we had in mind.
Yeah, and I would say the entire audience today, everyone is your subcommittee today, so we can lend our expertise and give some insights there, and then talk about what data points we need to pull, what resources we need to pull in, what voices we need to bring to a table, and we can make a strategic plan for that. So what does it look like with this white paper? What are we researching, and what insights do we need?
Yeah, so I mean, the different kind of sub bullets that we built in is kind of aligns to the different agenda items of the draft strategic plan, right? But namely, economic opportunity, leveraging partnership, economic opportunity being the first kind of tier of the draft strategic plan. The second being leveraging partnerships, collaboration, and competition being tier number 2. And then number 3 was building a strong workforce and supporting competitive skills attainment for residents being number 4. And then I think the 5th tier was continually improving process effectiveness while being responsible stewards of county resources. Those were the 5 main kind of top line subjects that we had, built in a number of smaller kind of bullets and sub bullets. I don't know if you wanted me to like share my screen, like just to give the wider subcommittee or the wider committee just a sense of the document that we built, or did we just want to verbally talk through it?
I don't think we need a sense. I think we need an action plan. So what do you need? What resources do you need? Like, what's the first step that we need to do? And are we having the right voices? And how are we going to utilize the voices and the powers and the connections on this committee to make that happen?
Well, I mean, my only ask is essentially just to set up a meeting, right? Whether that's through Jarrett, whether that's through somebody else with, I'm forgetting the name of the actual department that we would want to meet with. That is certainly something that I would ask the committee, what would be the most relevant and direct department that we would want to meet with. I know there was like a lot of back and forth on that. And we couldn't come to a consensus. So certainly I would ask that, but frankly, just in terms of an action plan, right? Just sitting down or submitting this paper to them. That I think is the most straightforward kind of next step that we would ask for. given that we have, this white paper built, we have this kind of draft strategic plan built. It's in the form of a white paper. That, I think our next ask would essentially be, what steps do we need to do, just to kind of sit down with the most relevant subcommittee in order for them to, for us to be able to talk through some of the recommendations that we made here.
So Sujit, with those main points that you mentioned from the document that you're referencing, and I know I have it somewhere from our last conversation. I mean, it encompasses several departments, and I know that was a heavy lift. And Casey, you probably know a little bit more about this than I do, but as far as the actual strategic plan, I know it was adopted, in the fall of last year, last October. But if there are specific, things like economic opportunity and some of those other points that you made, it's really about kind of just getting more granular, I would say. That would be my suggestion, I guess. Casey, I know you have your hand raised, so I'll defer to the acting vice chair.
This is more of just, a potential suggestion that may help figure out kind of what your end work product would be. I think my camera's glitching, sorry. The group that's working on One Fairfax, they've been working on an inclusive community engagement strategy and product. I'm not quite sure exactly where they are with that, but I think that might be a good group to hear from, especially asking how young adults are included as part of that engagement strategy and kind of what steps maybe they're, because my understanding is that this group would be producing this inclusive community engagement and then kind of shopping it around to all of the other departments. So that may be something, if you can get it on the ground floor and provide some input into that that program and that strategy, maybe that could kind of help get our thoughts included earlier rather than later.
Yeah, no, that's a good suggestion. So I guess I just want to confirm though, right? Jared, I think you had mentioned earlier. So this kind of plan that we had kind of drafted up and modified, does it still make sense for us to submit this in its current form, or should we go a different direction? Because I do know, we did spend, a great deal of time, right? Really going line by line through the strategic plan and really kind of, really trying to hone in on what makes the most sense from a young adult perspective, from a, talent outreach and education perspective. And we thought that, submitting these revisions could just be like a good starting initial deliverable that we could submit to, one department or a few, right? Whoever would make the most sense. But certainly if it, if the subcommittee or if the committee thinks that, I really liked Casey's idea where, talking to the One Fairfax team, if that's the more effective use of our time, we can do that too.
Yeah, I mean, my answer to you would be, both. I mean, honestly, like you can I think I may have seen something like one time or before, but it certainly would not hurt to submit what you guys have already worked on in 2021, because it's not like everything's evolving, everything's still kind of in motion, and then certainly a lot of those points would align with a lot of the other items that we talked about just kind of the gaps in engagement and kind of keeping the younger demographic, young adults, kind of in the know. So I really like that idea by Casey, for the inclusivity and community engagement. So I think.
And so what department though would you recommend? I know there isn't, you mentioned there isn't just one. And we don't want to just kind of plop something in their lap and just expect them to know what we're talking about, right? We want to at least just give them some context, tell them a little bit about what we've worked on and tell them why we've done it, tell them like the purpose behind this subcommittee and why we made revisions to this strategic plan. I don't know if there's going to be any kind of iterations to this, Fairfax County strategic plan in the out years, if the county might ever revisit it, but it could be something that they take into consideration should they ever mark it up in the future, right? And it could serve as a nice kind of touch point from this council to say, hey, we really looked at it from the lens of from the young adult lens, and we think these are the modifications that you all suggest making, right? So that was the whole reason why I proposed just getting some face time with one department or the other, briefly running them through the changes, letting them ask questions, and then kind of following up with them as needed. So certainly if there's any kind of recommendation you have there in terms of like a department that you would want to set us up with, just so we could get in front of them, we can certainly take that route while simultaneously doing the speaking to the One Fairfax team or another team that anybody else has.
Yeah, absolutely. I don't have an answer for you right now, but I can certainly, look into that. We can circle back around offline, but I'm not sure exactly. Just that was a little bit before my tenure, my service with the county, but I'd be happy to look into that.
Okay, thank you. And then I guess so the other suggestion that Casey mentioned, is there like maybe like a good POC there that we should be reaching out to?
Yeah, so I can give you a couple. Carla Bruce heads up that office, but there's also Robin Wilson and Dawn Hyman, I believe is her name. So any of those three, they'd be really great. And I know they're always happy to meet with people. So.
Oh, great. Yeah, and if we have like any email addresses potentially that one of us could send over, that'd be great.
Yes, yeah, I have all three. I'll send an email really quickly to Jarrett and he can share
Appreciate
those.
it. Thank you.
Absolutely.
Thanks, Casey.
And in terms of the strategic plan, I believe it's Amy Brobst, who is the contact. So I'll put that in the email too. So she may be someone to reach out to with the strategic plan suggestions.
And absolutely, that'd be great. And look, I think the last thing I want to do is cause more work for them, or they're very, very busy. I don't want to duplicate any efforts. I don't want to do something for the sake of doing it, right? I want to just give them an idea of what we're doing and maybe even ask them, right? Like, what could we be doing to help you from like a young adult perspective, right? This is what we've done so far. This is the initiative that we've taken. Is this helpful to you or is it not, right? Like just asking some of those like concrete questions to know directly to them. What are the most effective things we could be doing with our time so that it's not causing, duplication in work or prolonged efforts on their part, right? So I think it would be a nice little deliverable to show Amy and some of these other folks, but also ask them what more would you do if you were us, right? Like what could you use on a day-to-day basis? Sometimes when I think about these councils and subcommittees, we essentially work as like idea factories for the county, right? And so much and the people who work for the county are literally executing on these ideas. So it would be nice to speak to these people directly and ask them, what can we do to best assist you, right? Like we're this whole subcommittee. There are all these lines of efforts that we've stood up and these are the deliverables, but let us know what we can do to help.
Yeah, well, Suja, very well said. And just going back to your point, I mean, all of these, and again, Casey can definitely speak more to this, but yeah, all of these, plans, master plans, all these different, they're always amended, like they're, it's 5-10 years, there's no, so it's definitely a heavy lift and all that, but yeah, I really like that, the way you put that, just like, hey, what specifically can we do for you?
Yeah.
I like that approach.
Yeah, and I think that will also help us answer our questions of what type of deliverables or outputs are the best uses of our time, right? Like, ultimately, at the end of the day, it's like the staff members and the people working for the county that are going out and acting on them, right? So to go straight to the source and directly ask them, what's the most effective thing we could be doing? Sounds like a smart approach to me. So, and can, help us put something on the win column for us. So I hope that answers the question though, Denver. Sorry for the rant.
No, this is your subcommittee, so do as you wish. So please.
And I know just with the speaker that will be joining us shortly, and Suja, I'll defer to you. We've got about 13 minutes until Ellen Volo joins us, but she certainly, with her job, would be happy to kind of give some direction in how to help with a large issue such as this that we're going to speak about, just as an example.
Yeah.
And not just specifically this council, this group, but also, your own personal and professional networks as well.
Yeah, absolutely. Yeah, I mean, I remember when we were, going through this with Graham at the time too, right? Like I remember explicitly telling I was like, I don't want to give someone something that'll just collect dust, right? That'll just kind of occupy a nice little space in their office, right? I don't want to waste their time. So why don't we just ask them, right? We'll take the initiative and we will give them something, but let's also ask them, right? So, yeah.
Yeah, Sujit, I might have a list over you tomorrow. Casey and I will talk. I want to put you and everybody else, to work. I know I could use some help on some items.
Yeah, and obviously I know there's like swim lanes between what councils like this can do or can't do, but it's a good thing to be able to report out that councils are working in tandem with the county on specific focused agenda items for the young adults as it relates to talent outreach and engagement. This is what they came up with on their own in their, in a preliminary way. But this is what the county, after kind of incorporating their initial thoughts, this is what they asked them to do and solicited their advice on. And that's what we can go off and do, right? If someone can come back to me and tell me, based on the modifications and the suggestions and the research that we built into our strategic plan, and saying, hey, can you dig into this a little bit more? Or I challenge you on that, or can you go talk to this person? We can act on that, right? So yeah, and by the way, right, like I know all of this is easier said than done, right? Like it is much easier just to say, well, hey, we'll do this, or we'll, but I do think I'm kind of viewing this document as a starter home. They'll be able to see what we're capable of researching or the ideas that we're bringing. And if they need us to dig in a little bit deeper, build in a little bit more rigor, we can do that. So,
yeah, definitely. We definitely touch on that. So Sujit, we've got about 9 minutes until we start at 7. So between you and Denver, everybody else, whatever you guys want to do for till the next 10 minutes.
Well, I mean, I think I've basically preached what my general, I think, kind of next steps were. So certainly if anybody has any ideas, or based on our conversation yesterday, Jared, if we want to take a look, if we want to take 5 before the next meeting or so, we can do that too, whatever's easier. So
Denver, is this a straw poll? Or do we have to do an official vote? You're on mute.
you're on mute, Denver.
All right, I have to wait like 3 seconds after I click it. So I think we're fine. We can take a quick break, bio break. If folks want to stay and talk about, I know Casey, we talked about a letter thinking about the affordable housing thing with the board. I don't know where we are on that, or anything else. That works for me. And any questions about the general session? Jared, I actually do have a letter that we need to review, so I will send that to you as well. So
great.
So I have drafted that affordable housing letter. I actually have it in my email to send to Jarrett tonight. That was going to be one of the things I was going to talk with my subcommittee about tonight, if we had enough people. So I don't know if, we want to share this with the whole group and anyone can provide their thoughts and edits on it, or I'm happy to, I'd love to incorporate everyone's thoughts, not just my own. So basically, just for context, it's expressing gratitude for the recent support of a couple different affordable housing projects that the board has endorsed, but also in a nice way, asking that they continue to think about young adults. And I do think that's a big piece of attracting and retaining young talent here, is providing affordable housing. So asking them politely to continue those efforts and to continue thinking about our group. So I'll be happy. I'll send it to Jarrett, and Jarrett, if you are okay sending it around, we can give a deadline, and then we'll send it over to the board.
Casey, I think we can just pull it up and read it now and just vote on it now.
Do you want to do, or do you want to do it after we have our guest speaker? It's up to you. I mean,
I actually need a break, and if we could really have the opportunity to read it and digest it, that'd be great.
Okay, yeah, if we can send it and then
Perfect.
We'll talk after the speaker. Perfect.
Great.
Yeah, but Casey, yeah, you can just basically, you have autonomy on here to, obviously take control of the screen like everybody does. So all good. All
okay, we're gonna take a break now. We'll reconvene later. Great.
5 minutes.
Cool.
All right.
Thanks.
See y'all.
See you in a second.
Sam, your mic is still on. It doesn't bother me, but I just want you to know.
Oh, thank you. Thank you. I'm sorry. Thank
Oh
you.
no, it's fine. It's fine.
Hi, Ellen. We're going to be back on in 2 minutes. We're all just kind of grabbing a quick bite, grab, snack and all that. But we'll see you in a few.
All right, folks, it is 7. Can y'all notify me if your guys are on by turning on your camera? Thumbs up, something. Jared, I didn't see you. Hey.
And then it looks like Ellen just joined us. Thank you, Ellen. Good to see you. So we'll just give the others about another 30 seconds, and then we'll get ready to roll.
Alrighty.
Ellen, I like that background.
Thank you. It's my wishful thinking. Wish we were all at the beach.
All right, so Denver, if it's all right with you, I'll just give a quick introduction, and then Ellen, you can go ahead and share your screen and all that. But I'm very pleased to welcome Ellen Volo. She is the task force coordinator for the opioid and substance use in the county. I believe the acronym is the OSU, and she's here to come on and educate us with just the county's initiatives and outreach and whatnot to deter this issue that's certainly an epidemic that's been exacerbated by the pandemic over recent years. So I'm not the expert, but I'll hand it over to Ellen and get the floor.
Thank you. So let's see if I can successfully share my screen. Hopefully you all can see that okay. Oops. Yep. Can you see the PowerPoint? Okay, great. So thank you all for having me here today. Yes, I'm Ellen Volo. I coordinate Fairfax County's Opioid and Substance Use Task Force. And Before I get started, let me just give a little disclaimer that I do have a toddler at home who's going to be getting ready for bed, so I apologize in advance for any background tears that you may hear. So the county has, so I'm going to kind of give you the high level point that I'm hoping to kind of get across in this presentation. And really, you know, that point is that this is a huge community-wide problem right now here in Fairfax, also nationally and across the state. And there's all different things that we're doing to address it. And still, you know, it's an all hands on deck situation. And so where could your group and maybe the organizations that you're involved with, you know, besides for the YAA, kind of help get the message out, specifically for the young adult population, which you'll see in the data is an area we do need to focus on. So I'm going to really quickly walk through some slides with data, and then I'll go through kind of what we're doing here in Fairfax, and then ultimately end up with some questions for you all, kind of seeking input and some kind of strategic guidance on how we can better reach and work with the young adults. So you probably have seen in the headlines lately that drug overdose deaths have topped 100,000. And yeah, that's CDC data. But what you see on the chart here is not just kind of that the number is really high and astonishing. This is a national number, but that it's increasing pretty rapidly. So as you can see here in red, back in January 2015, that number was around 48,000. And so here we are just 7 years later, and we're looking at nearly 108,000 fatalities from overdose deaths involving drugs of all types. And what I think is super concerning, right, is this increase that you see on the right side of the graph, right? So it was kind of like trending up, and then there's been this dramatic increase. And what we have here for the latest time period that data is available is about a 15% increase from the previous time period. So the number itself is concerning. The increase from the previous time period is concerning as well. So looking at state data, you know, what's happening here in Virginia, we're seeing significant increases as well. This data comes from the Virginia Department of Health, the Office of the Chief Medical Examiner. And what you see here are kind of fatalities related to drug overdoses of all types. That's the pink line. Gun-related fatalities, the yellow line, and then motor vehicle-related fatalities. So just to draw your attention to kind of two kind of important takeaways here. So first, the increase in fatal drug overdoses from 2019 to 2021 is 1,000 people in just 2 years. And that's the increase, right? So in 2021, there were over 2,600 fatal drug overdoses across the state. And that's more than the number of fatalities related to motor vehicle deaths and gun deaths combined, right? So that's concerning, you know, from that vantage point as well. So I keep saying drugs of all types. What's really driving this? It's primarily opioids, as you can see here on this graph. So, you know, this kind of shows that of the fatal drug overdoses, really, we're seeing most of those as kind of involving opioids. Well, what type of opioid? It's really fentanyl, right? You've probably heard of fentanyl a little bit in the news. Maybe, you know, you're more of an expert on this than most people and you know a lot about it, but every day I come across people who've never heard of it, don't understand how dangerous it is, don't understand how kind of pervasive it is in our communities. So what you're looking at here is that all of the overdose deaths involving opioids, it's really driven by fentanyl primarily, and it's primarily illicit fentanyl. So, you know, that was state data and national data. And so what we're seeing in Fairfax, the Fairfax Health District, so Fairfax County, City of Fairfax, and Falls Church City, we were kind of happy that our fatal and non-fatal opioid overdoses were decreasing between 2017 and 2019. They were trending down. And that trend did not continue in 2020. So since 2020, our numbers have been rising, and they're still rising and kind of continue to trend upwards in 2021. And we're still, jury's still out on 2022. So the really, when you look at the data by kind of age group or geographic distribution, it really is an issue that's impacting people throughout the county, people of all ages. Though we do see that people in the 18 to 34 age group have the highest rates of fatal and non-fatal overdoses in our area. So that's one of the reasons why I'm so happy to be here today talking with you all, because you seem, your group is sort of so kind of in line with that age group. Oops. So locally here too, our fatal overdoses in the last few years have primarily been driven by fentanyl. The majority, almost all of them, involve fentanyl. And we are seeing a significant increase in the of fentanyl in counterfeit prescription pills. These can be sometimes, referred to as pressed pills, illicit pills. They're things like, Percocet or Xanax that are purchased on the street that do have fentanyl in them. The DEI has noticed a really big increase in the number of pills that they're seizing that have fentanyl in them. It can also be found, though, in other, illicit drugs like cocaine and heroin. We did have a press release from our police department last fall following a situation where 6 people non-fatally overdosed after ingesting cocaine that was laced with fentanyl. So fentanyl is really dangerous, as you may know. It's much more potent than morphine, and a tiny, tiny little bit can be fatal, like a grain of sand, tiny. So it can be in these pressed pills, and it's impossible really for a person's eye to detect whether a pill has fentanyl. So what you're seeing on the screen is, authentic pills alongside counterfeit pills that contain fentanyl. And so, really people just need to assume that if you're buying illicit drugs, there's fentanyl in it at this point. So the Fairfax County has had an effort to address the opioid epidemic and some of these issues that I've just talked through. Really since 2017, when our Board of Supervisors provided, a special pot of funding and, directed staff to really develop a special work plan to address the issue. And so we've been working on this for years now. We have over 30 different programs and activities underway across the county. So that involves public safety, our human service agencies, our neighborhood and community services. Schools are very involved. So it's really an all hands on deck collaborative effort, and all working towards the effort of reducing opioid related deaths and using data to inform and strengthen our programs. And we're working across kind of all of the 6 priority areas that you see on the graphic before you. So just to highlight a couple specific examples of our work, we do have a communications toolkit on our website where organizations, individuals can pull social media graphics that we've developed to highlight, getting help and the treatment available for opioid use disorder, the local services. In our Fairfax County Public Schools has a program called SAPS, Substance Abuse Prevention Specialists, where they have staff available to middle and high school students to provide early intervention for youth who may have substance use issues. And then if the youth is identified as having kind of a higher level of need, they're referred over to our Community Services Board. We did just partner, the county did partner with the public schools to put out a webinar this spring on youth substance use trends that we're seeing locally. We have been seeing kind of a concerning uptick in non-fatal overdoses known to our police department among youth. And so we came together to put out this webinar to really kind of walk through some of the data and highlight signs and sort of things parents should be looking for regarding youth and drug use. So that's available online, and we're probably going to do another kind of a date for that webinar. And then we also have a team called the Peer Outreach Response Team. This was a team created specifically to do outreach to individuals who have overdosed. it it consists of people with lived experience with substance use challenges. And so they are a phenomenal resource for anyone who may be experiencing substance use issues. You know, they're kind of like a friend to walk beside you, right? To kind of whatever recovery path the person wants to take, if they want to pursue treatment, if they want to go to 12-step meetings, this peer support person will help kind of navigate all of that and, you know, go with them to appointments, go with them to court hearings, whatever is really needed and desired. We've also partnered our public safety, our police and our fire and rescue have with that port team, so that when individuals are encountered by our public safety agencies for non-fatal overdoses, they're connected over to our port team for follow-up. Right, so the idea is that we're trying to provide some follow-up to prevent a future overdose. We do also have a unit in our police department that's the overdose investigation unit, specifically focused on investigating the source of supply and trying to kind of really reduce that supply. And then finally, we have a really innovative program in our jail. It's a treatment program where people are screened as they come into the jail for opioid use disorder, and they can be started on medication, and then the medication's like very highly effective to help them get into recovery. And then there's a kind of transition process to community-based care and treatment when they're released. And there's a lot of wraparound supports that go into that. It's a sort of technical sounding program, and it's also kind of a big feather in our kind of collective Fairfax County hat. It's really innovative and kind of first of its kind in the state and the nation. So there's lots of different ways that people can help address this issue. One of the first things is trying to really use person-first language instead of stigmatizing language, talking about opioid use and overdoses as more being kind of opioid use disorder, a substance use disorder, rather than a moral failing, you know, talking about a person who, you know, has tested negative or tested positive rather than saying they're testing clean or dirty on urine tests. Things like that. You know, it doesn't seem like it makes a big difference, but it really does, because it shifts people's perspective from thinking like, oh, this person can never recover, they're never getting better, to, yeah, you know, you can get treatment and you can go on to live a very happy and healthy life. So that's one of the big things that's really easy to do. You can also get trained in Revive, which is how to recognize and reverse an overdose. We have a program that you can do virtually online. It takes about an hour. And when you complete it, you get free Narcan mailed to you. So that's one that I really encourage everyone to do. And if you have organizations that you work with, we can set up special trainings for your organizations too. Safely storing and disposing of medications is important, you know, to stop that misuse from ever starting. There's a whole, you know, there's 4 different ways you can do that year round. We have the Fairfax Prevention Coalition, which is our community engagement arm. So we welcome anyone to participate in that. And then finally, you know, just using some of the social media graphics we developed in our communications toolkit to kind of raise awareness of the issue and the local treatment options available. So those are just a handful of ways that people can get involved in health, like general community members. And now I'd love to kind of hear from you on what you're seeing with this issue, kind of from your perspective and the groups you work with, how we might be able to partner. And then, you know, if you have any ideas on really broadening and amplifying our reach to young adults, I'd love to hear those too.
I'll open the floor for anyone who wants to hop in.
I would like to pitch in with you about the substance and opioids abuse. And I think it would be a great idea if we did do a lot of outreach, because it's very important. And a lot of high school students are getting into this environment. And I think it's very important to keep aware and sustain this alertness of drugs, overdoses. And I think we should really provide the community with public schools and colleges and online campuses with advertisements on what we can do to stop this, what we can do to further prevent this, and how we can have engagement. And I would think that would be most effective through advertising with like campaign slogans, or being able to have a bench like poster, or like you're on a campus, you visit campuses, you visit schools, you're able to discuss, like, you know how the military comes around and recruits. I'm thinking like that type of scene where we are able to communicate and discuss, so we show our alertness and awareness to be able to show that there is help, but also you're not alone, and to make, you know, it an approachable experience rather than a fearful and frightful one, you know?
Thank you, Sam. I kind of take a different approach in recognizing that a lot of first-time drug users don't end up being addicts, right? They do, and they experience and they move on. But with the presence of fentanyl, that first experience can lead and may lead to death. So I don't know how, and a lot of those folks, you know, first time, like, yeah, about college student, not saying it's right nor is it legal, will try cocaine, right? Or we'll try other substances, Adderall, Xanax, what have you, and not end up being this addict, you know, this pipeline that we focus a lot of our services to. So what is the county and or state doing to help folks detect in these substances to prevent those deaths? Because people are naturally going to try regardless of all the millions of dollars we put into advocacy. So what are we doing to do the detection and knowledge point?
Yeah, so that's a good question, and that kind of brings up a whole focus area that called harm reduction, which is basically this philosophy that like people, whether it's first time or multiple times, will still use drugs. And so how can you help reduce the harms associated with that drug use? One strategy is fentanyl test strips. And so these are kind of like a little test strip that people can use to test their substances before ingesting it. Those, you know, people can get from a variety of sources. We're really lucky in Fairfax County to have a nonprofit, the Chris Atwood Foundation, that has a comprehensive harm reduction program. We coordinate very closely with that organization as a whole. They're involved in some of the initiatives I mentioned. But for their comprehensive harm reduction program, they do provide fentanyl test strips, Narcan, a lot of other safer use materials. And they have a mobile van with stops kind of like rotating throughout the Northern Virginia region. And there's other places that give out fentanyl test strips. We do include them in our Revive kits that go to people who take the training, and other people participating in our programs. But, you know, it's also really important, I think, to focus on that like awareness piece too for the first time drug users, because they may not know that, hey, I should get a fentanyl test strip if I want to try this.
Absolutely. And I feel like that's when we hear, especially when I'm thinking about the high school populations, right? You get something off the streets, you're not sure, you don't have the full, you know, brain development that apparently ends at 25, and you go for it, and it can be deadly. So, I mean, I don't know, does DARE still exist? I don't know, like, how are we talking to students of like, hey, we don't want you to do this, but if you do, here are resources, right? Like, what are we giving? I know that's a political issue. Are we giving out fentanyl strips in high schools and middle schools? Like, is that available?
So that's a good question. And knowing your background, you'll appreciate that there is, you know, some language in Virginia code that may be a little bit of a barrier to that. And you're right that it is, you know, a very political issue. So to my knowledge, they're not being given out in our Fairfax County schools. Do I know everything that's going on? No. But to my knowledge, no. The SAPS program that I mentioned previously, they do a lot of prevention work. And they have a lot of different resources available. So they may have things that kind of do, you know, guidance, like if you are going to use, make sure you do it safely. I know at the community service board level, That's the Public Behavioral Health Agency here in Fairfax County that provides a lot of the treatment and prevention resources I've highlighted today. They do have kind of suggestions on, safer, like an overdose safety plan is available. And I'll put that in the chat. But yeah, it kind of talks through if you're going to, how to use more safely.
All right, I'm going to stop. I have other comments. I'm going to open the floor to other people. Would love to hear your insights and thoughts.
I just want to say, as a representative of Northern Virginia Community College, I'd like to, have some discussions around what partnership looks like. We have an Office of Wellness and Mental Health, and they're engaged in this conversation, discussion, and prevention. And I just think there's an opportunity to pull resources together. We have a, large number of students that live in Fairfax County, and it's not something that I must admit that I've seen us. I mean, we've talked about it, but I think seeing the numbers and statistics and knowing just how much is impacting the community and what's available is important. And we're looking to broaden what our wellness programming looks like. So I'd love to partner with you.
I would too. That sounds excellent. I'll put my information in the chat. It's also in this slide deck. We did recently do an event with George Mason, their undergrad campus, where we had our prevention team like set up a table there and, for kids to kind of walk by. And it was really, really successful. So we would be interested in kind of seeing how we could replicate that or adjust it to fit within NVCC.
Sure, would love to. Okay, I'll be in touch.
Awesome, thank you.
I just wanted to add that I really have learned a lot from this presentation. So I'm so glad that you came tonight to share this. I think the data is very, startling, and that's one way to really get the word out and make people pay attention. I think the social media toolkit, that's another great way to continue spreading the information. I'm really a proponent of meeting young people where they are already, just because there's so much out there for us to consume and for us to be a part of. So, I think going onto campuses, getting onto social media, TikTok, anything that it's like bite-sized pieces just to get that information across is really the best way to spread the word. So I really appreciate you taking the time to share this with us tonight.
And I wonder if there's opportunities like how we support survivors or folks experiencing human trafficking, sexual assault, right? Partnering with the business community just to have educational materials there, right? Or even I'm still on people are going to do it whether they are educated or not. So going to local breweries and bars and restaurants and having that available, having fentanyl strips available, like COVID tests, can we get them shipped to our door? I mean, that's a more of a federal initiative, right? That's more of pie in the sky. But how do we use places in which this high risk population is existing, right? Where mental health is declining, and maybe folks don't want to align their use of cocaine and MDMA and whatnot with a mental health issue, so that might not be space for them. So how do we get around that stigma and that barrier?
Yeah, all great ideas. I would love to see the day where we can get fentanyl test strips mailed to us from the federal government.
Once again, very political, probably will never happen, but everyone should have access to Narcan, right? Because you could save a life if you have it on you and with you, whether you're a user or not. But with that, I don't know if there's appetite for the council to have training. How long is the Revive training?
So it's about an hour. And actually there are training dates, like open enrollment dates. There's a whole list of them online. So you guys could do it kind of as a group, or you could do it, whenever it works for your schedule. I'll put the link in the chat too.
Thank you.
We do have a version of Revive that's called Rapid Revive that we do at events where, you can talk to someone for 5 minutes and get them trained too. And there's also a way that you can become a trainer if you'd like to do that in your kind of professional or volunteer capacity.
Yeah, that's great. It's one quick 30-second experience that can save a life. So that's wonderful. Yeah, I wonder if that could be like, BAC. Anyway, I'm going like above our authority. Like all BAC members should be trained in CPR, first aid, and Narcan usage, right? And revive as, extension of the government. But all right, I'm gonna stop talking. Any other comments?
Yeah, Ellen, I actually had Denver, if you don't mind it. Ellen, I had a quick question just regarding, I recall like years ago, and I haven't really been in this arena or, been researching it, although I try to, somewhat stay up to date. But as far as, how much of an issue are counterfeit pills that are, laced with fentanyl that, go through USPS or FedEx or UPS that I just remember, years ago where individuals who had, issues and, what is the terminology if you're not an addict? I would just say that you have a, just a
issue works. Yeah, opioid use issue.
Just an issue, but you can order it from like Canada or something like that. Do you see a lot of that just in your work, just from like sketchy online websites or whatever it is, and seizures and all that, just or increased tracking by these major courier services?
So that's a really timely question, because the New York Times today came out with an article about nationally how many kids are using social media to buy some of these drugs that have fentanyl in them. And so, yeah, like TikTok, Snapchat, like you name it, all of the social media companies, there is that issue. And of course, in a lot of the situations, I think it gets mailed to the kids. So I'll put that in the chat too. It was a really interesting read on kind of what's some of the national trends.
Great, thank you.
All right, Ellen, well, we appreciate your time. Thank you so much for being here and sharing your insights, and definitely got my attention, and definitely is something we all need to be allies in and work towards, because no one should, die because they thought they took an Xanax. So I appreciate you. Any closing comments before we say goodbye and give Ellen back her evening?
Thank you.
Thank you for having me.
Awesome. Thank you. Thank you for being here.
Thanks, Ellen. And just in case you guys didn't get the chat, I'll be sure to distribute Ellen's contact information.
Awesome. Thank you. Yeah, I did not see it in my chat. Some of mine just might be delayed.
I'll put it all in before I leave.
Okay. Awesome. Thank you. Do we want to transition quickly to the letters, since that was a conversation? Do we want to pull those up and talk about those? Casey, I don't know if you want to go first.
Sure. So, I mean, I can share my screen. I don't know if you want to edit by committee, or if you want to, share the draft and people put in track change edits, whatever works best. It's really just, like I said, a short and sweet letter that our subcommittee, the Planning, Infrastructure, and Transportation Subcommittee, had asked to put together. Really, we just wanted to, again, support the recent affordable housing initiatives. First, the board did approve a $33 million grant in housing blueprint loans, and these were to fund the development of 175 affordable multifamily housing units in a development in Tysons. And in addition, following that, they did increase their commitment goal to 10,000 new net affordable housing units by 2034. So that was doubling their previous commitment. And some supervisors even took an extra step and committed to a certain number within their magisterial districts as well. So, I just wanted to thank them for that. And, of course, it acutely impacts the young adults. Of course, it impacts the entirety of the community. But we just want to make sure that Fairfax County maintains being a great place to live, work, and play, and helping attract and retain really talent and in the workforce. So affordable housing helps everyone. And then very briefly, just a ask to continue supporting and furthering their work in these efforts. I did pull some thoughts that I had previously mentioned about prioritizing first-time home buyer programs as well as rental assistance, especially targeting the young adult community with these programs. Because I do think that creating a pathway to homeownership is really important for young adults in Fairfax County. So that's kind of what I focused on. But again, I'm happy to include any other thoughts or initiatives or anything else from the group in this letter to send over to them.
Yeah, I think it looks great, short, sweet, to the point. I was able to read it. Are there any comments or issues?
I like it. I have a quick question. I didn't get to read more about it, but the 10,000 new affordable housing units, on the note of like home ownership, do we know if there were any specifics of whether they're rental units or homeowner ownership opportunities?
They were not dedicated to be one or the other, which is why I had added just kind of a little bit of oomph towards let's make sure we're supporting first-time home buyers as well, because I think that's really the way to create equity and eventually generational wealth. So if you want, I can strengthen that up a little bit to encourage them to consider as part of their 10,000 net for a portion of those to be, owner occupied.
I would think that's a good idea, but whatever the rest of the committee says is cool too.
I think that sounds like a great, friendly amendment.
Great. I can type. Okay, I can make some edits to that. Any other thoughts or things to include in this?
I think overall it's going to meet the young adults' attention, and it's going to be a good impact, and it's going to be a wide impact. And I think it's a great letter to the Board of Supervisors.
Great. Thanks, Sam.
Yep. Likewise, Casey. No changes.
Perfect. Thank you all. So is this something, Denver, do we need to vote on this, or do we just, okay.
Yeah. All right, so with Menor's friendly amendment, is there a motion to approve Casey's letter to be sent to the clerk and the Board of Supervisors?
Yes.
Okay, so moved. All right, is there a second?
Second.
All right, all in favor?
Aye.
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 Any opposed? Any abstentions? Great, thank you, Casey. Wait, I gotta pull up the document. That is not the right document. We have one more letter that we've been talking about for a bit. I literally just sent it to you, Jared, and I can't find it. That's not it.
Denver, I have it if you can't snag it.
I just pulled it up. All right, we're good.
Okay.
I wish we had some cool letterhead. I don't know if any other council does that. All right, let me zoom this in. So this is a pretty simple, this was the ones where I asked you all for the BACs that we want a young adult representative on that would also cross-serve with the council. On behalf of the Young Adults Advisory Council, I want to thank you for creating and approving and supporting Young Adults Advisory Council. We've been working diligently to review and impact county operations for over a year. We have met with department heads, administrators, county staff, and representatives. As we have met, it has been abundantly clear that the voice and view of young adults is missing in most corners of the government operations. Over the past year, we have attempted to impact these areas. Over the past year, we have attempted to impact these areas that are advocated and influenced by pre-existing board authority and commissions. After much deliberation, the council, we are seeking the support of the Board of Supervisors and implementing a young adults representatives on the following boards and commissions. And this isn't all, we would love so many more, but we didn't want to overwhelm and literally put every board and commission on the list. So there's 28 in total based on what was submitted. Allowing young adults to have a voice in these places will allow our perspective to impact and shape Fairfax County for decades. With young adult representatives impacting those corners of the county, the council will then stand as a coalition of young adult thought leaders, sorry, who will work collaboratively on how to impact their respective board, authority, or council and beyond. With my very ugly signature. Any questions, edits, suggestions on this? I can scroll back down.
I am seeing a black screen. Is anyone else getting that, or is it just me?
I see the black screen as well.
Okay.
Have you seen a black screen this entire time?
No, it just
No.
just happened when you were going to scroll back up.
Do you see it now?
Yes.
Oh, yay. Okay. I'll scroll down so you all can see all of the boards and councils. So I think 28 is still a huge ask. I definitely think there are a top 15 here if we need to negotiate with the board. Like Tenant Landlord Commission, we should definitely have someone there. Human Services Council, Human Rights Commission, absolutely. GMU, I think that's obvious. ECOAC.
Is there not already a student representative on the university boards?
So there is a student rep, but there's not a young adult rep.
Okay.
So yeah, and there also is a student rep on, I think, EQUAC, which is like a high school student. But I would love to see also a young adult and this to be a permanent position. Another pushback in which the board can say is like, oh, well, we already have someone under the age of 35 or whatever our limit is on the council or on this board. Doesn't that count? And I think our rebuttal is no, because we want a dedicated seat in which if that person becomes 38 and ages out or moves to a different county, we have a dedicated young adult voice on that respective board.
Okay.
Maybe
Thank you
it's
for
worth
providing the clarification.
I'm wondering if it's worth anticipating that rebuttal in advance and adding a sentence that basically just says that, like to explain like this position would be a dedicated young adult between the ages of blah blah, just in case they try and come back at us.
I will take that as a very friendly amendment. Happy to put that in. Any other questions or comments?
Yeah, I think Eddie has a quick question. Eddie?
Yes. So, what was the question about? So if I join from Let me say this, for example, if I join one of these committees for assignments for young adults or implementing one of the commissions or activities to you can participate or to participate, which of the options would be best fit, a good fit, or for example, is it a good fit or to be realistic on one of these young adults to participate more realistically?
I don't know if I understand the question. I'm sorry, Eddie.
What I'm saying is, what I'm trying to say, the question is does the young adults council have to be realistic on what are the options of decision choices? That's my question. Sorry about the clarification.
Is it realistic to make this ask, or is it realistic to have a young person? Like, I'm not. Are you worried about like
realistic joining on whichever participation on any of those following recommendation?
So I mean, it wouldn't necessarily be us joining them. These would be new board appointees in which the board of supervisors will use its current decision process to appoint someone who meets those criteria.
Yes, that's what I'm talking about.
Yeah. So it would be up to the board of supervisors to appoint and make that decision. So if there are two folks who are 25 or 15 or whatever who are applying for the same position, right? If there is like an at-large position open and then a young adults position open, there's nothing holding them back from having two folks within our age group to be placed on that board. And this is encouraging more diversity in age on each of these boards or councils. Am I answering your question?
Yes, that's the one. Depending appropriate from young adults to 18, whichever the 18 to 29. And which one? The young adults, 18 to 26 or 18 to 29 or 18 to 34, the youngest to begin.
Yeah, I would say we would use the age parameters required by our bylaws, which I do not have in front of me. Jarrett, do you know the age? I don't know. I'm
18 to 34.
18 to 34.
That's what I thought.
Check. All right. Any other thoughts, comments, questions?
And just, I mean, I know this has been something we've talked about probably since the first meeting this year, but I did put in the chat just all the different BACs if anybody wants to drill in a little bit more. But I'm confident that we've all kind of done that and sent stuff to Denver. And this is, correct me if I'm wrong, Denver, this is what you compiled from everybody's correspondence back to you, right?
This is the best because originally we had a list about 50. So I tried to be diligent in narrowing it down. And my goal was 25, but we got 28. So I was like, all right. I tried my best to be like, some of my boards didn't make on it, right? And just trying to be understanding.
Yeah, no, I think that's great.
All right, so with the friendly amendment of adding the clause of it doesn't matter, well, I'm going to actually be more eloquent, but like in short, it doesn't matter if someone is already on the board who meets our criteria, there has to be a dedicated seat because we need representation. With that friendly amendment, is there a motion to approve?
So moved.
Is there a second?
Second.
All those in favor?
Yes, aye.
Aye. Any opposed? Any abstentions?
Aye.
Awesome. All right, cool. I will make that edit, and once again, I'll go off to the clerk. Well, thanks for letting us derail a little bit from the original agenda. Do we want to come back and talk about our response or how we want to, our next step, if there is one, with the information presented today as a council? Do we want to make any recommendations based on today's presentation? Do we want to bring it back to the subcommittee Well, which subcommittee would this be under?
Yeah, Sujit, this would definitely be from Ellen's presentation, the talent outreach and engagement, I feel like.
Yeah. So I don't know if we as a council want to make a statement that we want to send over to the board. I know it has been a discussion in previous meetings that we want to have an action at the end of all of our meetings. So do you all want to have a response? Do you want to take this back to the subcommittee to figure out what that response and or ask is? How are you all feeling?
I don't think
Well,
we need to get back to the subcommittee. I think given we already have the full kind of committee here and we're discussing it here, we can take the action here, right?
Okay.
Yeah.
So Sam, your suggestion about kind of like almost like marketing and all that and using that analogy of like, you know, military recruiting and everything, like, did you?
Well, it was, yeah.
No, I thought, for me, I thought that was great. And obviously they're doing a lot with social media and all that, but do you want to possibly make specific recommendations, like about like a bench or something like that, or, you know,
Definitely.
something
Like
that could,
recruiting like area, like for specific like to dates and times. Yeah.
as far as like putting that out as like a, you know, a deliverable recommendation to the board.
Correct. I will get that written up.
Yeah, that'd be great. So I think, yeah, our deliverable to the board, it was saying like, oh yeah, we met today with Ellen, learned about the opioid crisis as the voice of young adults in Fairfax County. We expect X. If you want to share that with me, I definitely think we should also hit on, I don't know if this is just me and I'm just like preaching like my own testament. I don't know, but like the county should invest in making fentanyl strips more readily available and making partnerships with businesses. Like, once again, people are going to do it, unfortunately, right? And if we can just be ahead of that and destigmatize it, right?
I agree with you, Denver, that we should add that into context to make that more abbreviated, to make sure that they do get the special idea. Well, to get them on the idea of this is important, this is what we request. I agree with what you're saying, so I think we should add that in on the deliverable.
I want to make sure I wasn't crazy on this whole like narrative that everyone's doing drugs anyway. So appreciate that.
Yep.
All right, Sam, do you want to take lead? Our secretary, you want to take lead on the first draft?
Sure. Okay. Alrighty.
And we can discuss that in the beginning of next month. And just make sure we have the approval of everyone.
Correct.
Quick question, Sam, just because I know Ellen, like they've like SAPs and all that, just from your experience, have you seen this? You know, some of these outreach efforts already?
Unfortunately, there has been a very major uptick in substance with high school, specifically with the seniors, with middle schoolers especially.
Right.
Middle schoolers are being attracted to this type of abuse, to this type of negligent behavior by other students, because what happens is that it's a stigma, it's a peer pressure tactic to make it look cool, to appeal that, oh, you know, you don't do this, you're not a part of our type of group, type of thing. So it's that type of bullying, I put it as peer pressure, bullying, and harassment. And I just think that all evolves into a big uptick where our trend comes. And especially when it's becoming easily available, that's where more and more high school students and middle schooler students, and maybe even lower than middle schooler students, are getting affected. And that is something that we just got to really address. And this is something really important. And I agree with Denver on the testing, because I think this is really to show an accurate data for our school system to really get on this and to really push forward with, hey, this has to be limited. How can we utilize our assets to bring this trend down, you know?
No, yeah, I completely agree. But just curious though, if you've seen the outreach from like the SAPS program and all that at school for
Unfortunately,
as a deterrent.
And good point, Jarrett. I unfortunately haven't seen as much support into this idea of we need to prevent this behavior. Unfortunately, I don't see that it's a well spread idea. I think that everyone commonly knows that, oh yeah, this happens, but it's not really a, hey, you gotta bring more advertising. It's not like the military shows up every like month or so to do their advertising. There's way more military advertising than I see drug substance and abuse. I just see the drug substance abuse as a cover or some type of blanket that people are afraid of speaking of, when in reality it shouldn't be. You should be afraid. It should be hey, this is happening, and this is, there is help and there is utilities to be there for you, because this is getting out of hand. And when Ellen was talking about the percentage, which was like 15% from 2021 and 2020, there was none, right? This is going to increase, and I just see this as we got to do better.
Thank you, Sam. We appreciate your perspective, actually, very much so on that. So,
Thank you.
Of course. Technically, we have subcommittee updates, but I think we kind of already did them. Judith, Casey, do you guys have anything else you want to cover?
No, nothing to add. I know that based off what I shared just in the subcommittee meeting, I know that Jarrett, you're just going to follow up on the POCs, right? In terms of folks that I can be reaching out to set up that face-to-face. And I know Casey's sending Jarrett the department names and contact addresses for One Fairfax as well. So I'll just be on the lookout for that.
Yeah. Casey, it's already in my inbox, so thank you.
Awesome. All right. Well, it's 7:55. I don't think we have ever been early. But are there any? Oh, Jarrett, do you have any announcements, questions? Yeah, you do.
Why? Because I'm grinning. This would be more pertinent to the planning outreach or planning infrastructure and transportation, but HCD, we did reach out to them, and they are arranging to have a individual come on and speak about the specifically the affordable housing with the first-time homebuyers programs, and a lot of stuff that Casey hit on with her letter, the missing middle, starter homes, and all that. So they have, they've confirmed for the next meeting for the 23rd of June. So I think that'll be good. Everything's gonna be run by Tom Fleetwood, the director, and we'll have somebody on and be able to provide their expert opinions and everything that they're already doing. That's all I got.
All right. Any other announcements? Words of wisdom, closing statements, anything else? All right. Hearing none, I will. Oh, I froze. Can you guys see me? Okay, we're good. We're back. Hearing none, I will entertain a motion to adjourn.
I vote yay.
Okay. All right. Casey says so moved. Sam, I'm going to take you as a second. Without objection. Good night, y'all. We'll see you next month.
Good night.
Have a great night.
Thanks, everyone.